Weaving there, a family doctor from Brampton in Cumbria, talking about today's report.
Well, if you've got any experiences you'd like to share about your GP's surgery, good or bad, we'd like to hear from you.
Yes, you can get in touch by emailing us. You know the address, but we'll tell you again, pamanian@itv.com.
Now, a dentist from Sunderland who set up a charity to provide dental treatment in underprivileged areas across the world has just returned from Morocco.
Michael Oliver and his colleagues from the Dental Mavericks spent 8 days treating children in the remote village of El Jihab in the north of the country.
They raised £10,000 thanks to donations from patients to provide the essential treatment. For many of the youngsters, Michael is the only dentist they've ever seen.
Michael is here and we'll be talking to him in just a moment. But first, here's a flavour of the important work he did in Morocco.
To come to a country that doesn't have any dental care at all and to do just a little bit, but to these people it probably felt a lot. It means a lot to me, and hopefully those children who've had the treatment will feel better for our efforts.
What a day. Just absolutely amazing day to see so many children and help them. Has been a bit emotional as well, wouldn't deny that. Held back a few tears on a few occasions, but it's been really good.
Thank you for your all and for your work you have do with my students in the school.
Some wonderful images there, and Michael joins us in the studio. Good to see you. Tell us then how all this trip came about.
Well, it really goes back a year, Pip. I received a phone call from a dental colleague of mine asking if I'd be interested in joining in a charity they were trying to set up to provide dentistry to areas of the world that don't have dentists. With a little bit of research, we discovered North Africa and Morocco was one area we could visit because we actually had some contacts with the officials there that would give us clearance for dentistry. So last year we visited a little village just in the foothills of the Rift Mountains called El Jabbar, where they don't have a dentist. And when we got there, we were very surprised at the dental neglect. So originally we'd planned to travel to other areas of Africa to provide dental care, but when we got there we realised we couldn't leave them and go somewhere different the following year. So we returned this year. We had a whole lot more equipment with us, we had more dental nurses with us, we were much more organised, and we treated about 170 children,
wow,
which was
that's
tremendous.
Quite a lot.
It was tremendous.
So what sort of a difference were you able to make to those children's teeth?
Well, when we got there last year, we were very surprised to find they had no dental care, Ben. So we, first of all, we had to treat pain symptoms. In this country, we would repair teeth, but in Africa, children come to you with pain. So obviously, you prioritise those children to get them out of their pain.
And just describe briefly what the state of their teeth is like compared to the children you see here.
Compared with children that I would see every day in my surgery, the neglect is enormous. They have dietary problems over there. We would consider it as dentist dietary problems. Their national diet is very sweet, and they have sweet teas from the age of 2 or 3 all the way up into adulthood, which when they don't have any dental treatment coupled with a high sugar diet, their teeth suffer pretty badly. So when we examined the children, we find badly decayed teeth that were beyond repair and causing them pain, so we had to extract those teeth.
What sort of a difference will that make to their lives going forward, presumably?
Yeah, well, basically, getting those children out of pain makes a huge difference. Maybe you haven't experienced dental pain, but it isn't very pleasant. And when these children come in and 2 or 3 of their teeth are generating a high level of dental pain, it's not a situation that they would want to continue with. So their parents bring them down from the hills and ask us to treat them. We see abscesses in these children's mouths, and as I say, the only treatment we could offer was extraction. But they came back to see us the next day out of pain, which was quite a rewarding...
Massive help for them.
Absolutely.
Quickly,
yes.
How did the Sunderland strips go down?
The Sunderland strips went down very well, Pip. I was first of all surprised that they recognised the Sunderland strips in North Africa, but the power of the Premier League had even penetrated North Africa, and the children loved it. These were gifts that they would never normally have, and we were able to hand out about 100 Sunderland strips. Fantastic.
And the gift of dentistry as well.
And
Michael, I know you're planning to go back to Africa. Good luck with the rest of the project.
Thank you very much. Yeah, I look forward to it. Thank you. Thank you.
Now, we all, or most of us, do like a trip to the